Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really excited today to bring on one of our partners from Physicians Regional Hospital, Dr. Shirlynn Chu. How are you this morning?
Doing well. How are you?
Really good. Thanks so much for asking. Now, I want to get to know you as a physician. Tell me a little bit about your history and how you came to get into the field of medicine.
Well, I've always been interested in medicine. My mom would like to say I wanted to be a doctor from the age of 5, which is probably about true. As I was going through school, I always had an affinity for science and math, and so it kind of just fell into my lap in that sense. I enjoy learning personal history of patients, and what keeps me going.
Now, I understand that your true passion really is diabetes education. And in the spirit of December being National Diabetes Awareness Month, talk to us a little bit about what diabetes is.
So, diabetes is one of the major chronic conditions that a lot of patients will present with. For those who don't know, it's a disease in which your body doesn't make enough of the hormone insulin properly, or it doesn't respond to it in the way that it should. And this results in too much blood glucose, or, layman's terms, sugar, to build up in your blood. Diabetes has two different types. There's a type 1 and a type 2 diabetes. Many people are familiar with type 1 being that quote unquote childhood diabetes. It is an autoimmune disorder in which the pancreas doesn't make enough insulin. But some people would be surprised to know that there are adults diagnosed with type 1 diabetes sometimes, and it is called LADA, or late onset adult diabetes.
That's interesting. Now, if I've been told that I have pre-diabetes, what exactly does that mean? And what kind of screenings do you do for something like that?
So, prediabetes is a condition that doctors look out for, in which you might be more at risk for developing type 2 diabetes, which is that diabetes that's typically associated with high blood glucose for a long time, like with people with obesity. Prediabetes does not mean that you have diabetes yet. It just means that your sugar levels are showing that they're on the higher side, and you might be more at risk for developing diabetes. Because your sugars are higher, you are also at risk with prediabetes for some of the risks and complications that are associated with diabetes.
Yeah, let's talk about some of those symptoms and also how can someone that's on that scale of pre-diabetes possibly reverse some of these effects?
Yeah, so some of the risks with diabetes or prediabetes in general are, cardiovascular disease. You have higher risk of retinopathy or eye issues, kidney disease. So many things that oftentimes go missed if you don't follow up with a physician regularly. As far as reversing or preventing the onset of diabetes once you do have prediabetes, there's a lot of research behind lifestyle modification, which includes diet and exercise. So that specifically means eating foods that are healthy for you and in good moderation, meaning cutting out sodas or things high in sugar, things that are high in simple carbohydrates. You want more of those complex carbs. And you want to be exercising. The American Heart Association is recommending at least an accumulated 150 minutes of moderate intensity brisk walking, or something that can get your heart rate up a little bit per week. So that's 30 minutes 5 days a week. So something like that. And it's really been shown that if you stick to this kind of lifestyle modification, you can potentially reduce your risk of progressing onto type 2 diabetes, or even improve your health to the point where you're no longer considered pre-diabetic.
That's great. Now, what, and maybe I'm asking the question incorrectly, but when you say symptoms, how would someone know what are some symptoms that you might be experiencing that would show that you may be developing that prediabetes, for example?
So, unfortunately, diabetes is kind of like high blood pressure, where most of the time patients don't even realize they have it. It's kind of an insidious course. Sometimes patients will experience symptoms like extreme thirst, more frequent urination. They might have changes in their weight as far as unexplained weight loss. They may be feeling more fatigued, drowsy. They might have blurry vision, or they might develop, loss of sensation in their feet, developing sores or wounds that don't heal properly.
No, this is all very interesting. And I think that, just going over some of the things that we can do to prevent diabetes. And I think you hit the nail on the head when we're talking about lifestyle. Are there any other suggestions that you have, any supplements or anything like that that make, keep us healthy and off that spectrum?
Well, as far as supplements, not in particular. What I do recommend is following up with a physician at least annually, especially if you don't have any chronic conditions, but even more so every 3 to 6 months if you do have any other associated chronic conditions. Preventative medicine is really the way to go. Educating yourself, knowing about diabetes is the first step. And then asking your physician about, hey, I have these symptoms that I'm not sure what they mean. What do you think I should do? That's kind of the best step.
Yeah, so having that open dialogue with your physician is incredibly important. Having your annual exam, I would say if I can have like a takeaway from my experience with you today and learning about diabetes, it's exercise, eat right, and have that open dialogue with your physician.
Exactly.
Well, Dr. Chu, it was incredibly nice to get to know you. We appreciate you with Seniors Blue Book being such a value partner with Physicians Regional. And I want to thank you for your time this morning, and I hope you have a great day.
I appreciate it.